Hi everyone, today I am going to discuss about how to read the endoscopy report. In endoscopy report, we have indication or complaint. Why the person has undergone endoscopy. The person may have endoscopy because of abdominal pain or anemia, that is less hemoglobin, or because of unexpected weight loss, or if there is any foreign body ingestion, then the endoscopy is also needed. Next comes the preparation. What all the precautions or safety measures the person has taken before endoscopy. Generally, before endoscopy, the person should not eat anything 8 to 10 hours before the procedure. So, this preparation has been done. We call them as NPM, means nothing per mouth. NPO means nothing per oral. That is, the person hasn't eaten anything before the procedure. Next comes the pre-medication. Pre-medication is nothing but what are the type of medicine that has been used to anesthetize during endoscopy. Generally, endoscopy is done under topical anesthesia, that is 2% lignocaine or xylocaine. In certain conditions, it may also be done under intravenous medication, that is by injection of midazolam. Next comes the pharynx, vocal cords, esophagus, stomach. In stomach, there are 4 parts like fundus, body, pylorus, antrum, and next comes the duodenum. In duodenum, generally there are 4 segments, that is D1, D2, D3 and D4. However, in upper endoscopy, only D1 and D2 sections are analyzed. So, in upper endoscopy, these sections are checked whether it is normal or abnormal. If everything is normal, they write as normal. If there is any redness, they written as erythema. If there is any whiteness, they call it as fungal infection or candidiasis infection. And how the walls are then? If there are any erosions, they call it as ulcers, and where the ulcers are located. If the ulcers are in the esophagus, they name it as esophageal ulcers. If the ulcers seen in the stomach, they call it as gastric ulcer. In the stomach, which section of the stomach has been involved? They name it as per se. Like if there is in the antrum, we call it as antrum gastric ulcer. If it is in the fundus, fundus gastric ulcer. If it is in the duodenum, duodenal ulcer. And other section is polyps. Polyps is nothing but the unusual growth of tissue. So during endoscopy, if they find any unusual growth of tissue, they name it as polyps, and depending upon the anatomical location, the name is given. Like if there is the polyps are seen in the esophagus, we call them as esophageal polyps. Next comes the varices. Varices are nothing but the dilated blood vessels. Whenever during endoscopy there are any dilated blood vessels, we call them as varices. Next comes the hiatus hernia. Generally, the esophagus and the stomach are divided by a diaphragmatic muscle. But in certain conditions, the stomach bulges and pushes the diaphragmatic muscle and reaches the chest cavity. We call this condition as hiatus hernia. Next comes the impression. Impression is nothing but the report summary. So, if there is any inflammation in the stomach, we call this as gastritis, and if there are associated with the ulcers, we call it as erosive gastritis or ulcerative gastritis. And if there are any ulcers, we call them as if there are any ulcers in the stomach, we call them as gastric ulcers. If there is ulcers in the duodenum, then duodenal ulcers. If there is any hiatus hernia, then hiatus hernia has written in the report. So with this basic information, we'll read few of the endoscopy reports. In this report, we can see first is the instrument used. That is the instrument used during endoscopy. Second is the esophagus. In this report, they mention that esophagus is normal. There is no changes in the esophagus. There is no ulcer. There is no hiatus hernia. And in the stomach, they have mentioned that there is gastric ulcer with gastritis. Changes are seen in the fundus region. As already mentioned, in the stomach, there are 4 regions. So, in this report, they have mentioned that there is stomach ulcer is seen in the fundus region. Next comes the pylorus. Pylorus is normal. And the duodenum, they mentioned that there is no duodenal ulcer is seen, or there is no duodenitis. Itis means inflammation. So, there is no duodenum ulcer is seen, there is no duodenitis, duodenum is normal. In the impression, that is the report summary, they mentioned that there is gastric ulcer is seen with gastritis. This is the report summary. Coming to the next report, in the next report we can see the indication, that is the chief complaint why the person has undergone endoscopy. So here the indication is anemia. Because of anemia or low hemoglobin, the person has undergone endoscopy. Next, the instrument used and the sedation, and next comes the esophagus. In the esophagus they mention that esophagus is normal. In the stomach they mention that fundus is normal. However, in the body and antrum there are patchy erythema is seen. That is, some redness is seen in the body and antrum region of the stomach. In the duodenum they told that D1 and D2 there are certain erosions are seen. Next comes the procedure, that is the biopsy. They mention that biopsy has been taken in the D1 and D2 of the duodenum and the antrum. And next comes the impression, that is the report summary. In the report summary they mention that is there are gastric and duodenal erythema and erosions. It means in the duodenum as well as in the stomach there is certain erythema is seen and certain ulcers are seen. This is all about how to read the endoscopy report. Hope you like the video. If you like the video, please share and subscribe our channel. Thank you.